going. Hi, my name is Sherry Awad, and today I'm going to be doing the trach care validation. And before I get started, I'm going to say my 7 rights, which is, my 7 steps, which is to check the doctor's order, to wash my hands, to identify the patient, to identify myself, to ensure for privacy, and to explain the procedure, and to gather all of my supplies. So I did all of that. So to get started, if I had anything with me, I would elevate the bed to working height so that to prevent any back injury. I would elevate the head of the bed to a 45-degree angle, and then I would auscultate the patient's lungs anteriorly and then posteriorly. If they're able to sit up, I would assist them to sit up and listen to their lung fields. And if they can't sit up by themselves, I would have them turn over so that I can listen to their lungs that way. Okay, so I did that. And now what I'm going to do is I'm going to check the suctioning machine. I'm going to turn it on. Then I'm going to kink the piping to make sure that it suctions from 100 to 120. So I did that, and that's good. And so now what I'm going to do is I'm going to open up my sterile field using this the suction catheter kit. I have to get closer here. Come closer. I'm just going to throw this in the garbage. And here's the cup. So I'm going to be filling up the cup with normal saline, and I'm going to make sure that it's not expired or anything like that. So I'm going to be opening up my sterile field. And okay, so now that I have on my sterile gloves, I'm going to be taking out the suctioning tubing. Be careful not to contaminate it. So now what I would do is I would connect this end to the machine. And I'm going to just be checking that it's suctioning within the saline. Okay, and it looks good. So now this would be the patient's. I would remove the oxygen, and then I would go in until I feel resistance, and then I would just suction, and then I would take a break, go back in the sterile water, and repeat, and do that, go in until I feel resistance, and then do that as needed. So now, okay, and I would remove the suctioning as so, and then I will take off my sterile glove with the piping and just throw that in the garbage. And then I would take off the dressing that the patient would have here. I would get rid of that and throw that in the garbage. And now I could get rid of my sterile field. So now what I would do is I would open up the inner cannula kit. And I'm going to perform hand hygiene and then just put on a pair of gloves. So I'm just making sure that this cannula is the same size as what's already in the patient. So I'll be removing that cannula and getting rid of it. And then carefully picking up this inner cannula by the wings so as not to contaminate it. I would insert it into the patient, and then I I would fill up the cannula container with half saline and half hydrogen peroxide. And then I would take a Q-tip and dip it into the solution and clean under the stoma, and then get rid of that Q-tip. Grab another one, dip it into the solution, clean above the stoma, get rid of that. Then I would take my gauze pads, I would take one, and clean up, dry it, and then I would take another one and then dry the top. And I can get rid of that. So then what I would do is apply the dressing. And then at this point I would reattach the oxygen to the patient. And then again I would auscultate the lung fields in the front and the back. And in the middle of me cleaning, I would assess for any signs of infection and document as such. And then when I'm done with the procedure, I'll document everything. I would document all my findings, any signs of infection. I'll make sure the patient is okay and comfortable. And that's it. You can turn it off now, but just press the button.